Hello, my name is Michael Migliori. I'm the Chenango Memorial Hospital Foundation Annual Campaign Chairman. As chairman, I have one very important job to explain why you should donate to this year's campaign. Listen while three of your fellow co-workers explain how your donations are put to good use.
There was carpet on the floor, outdated border, institutional gray on the wall. Wasn't very becoming at all. I work in the ortho and gen surge department, so I'm fond of what they did because now the workflow is much quicker for us nurses. And then we have a new nurses station in ortho general surgery, and down there's definitely more space. Definitely more space for all of us nurses. It's more spread out, more countertop space. Yeah, when they come in, they say, "Ooh, it looks so nice. I like the colors. I like the floor." For some reason, they say the rooms look bigger. I don't know if that, but they're not. But I just think the paint gave it a facelift. Definitely more updated, modern. And I think when patients see that your building's updated, your healthcare's updated, everything's up to date rather than outdated.
Being in a small hospital, it is difficult when you have more than one labor patient at a time. It's running room to room, trying to make sure and keep track of the baby's heart rate, the mom's contractions, make sure everything is okay with them, and not having to worry about the one next door that you got to get into real quick. With the monitoring system, there's one monitor in every room. No names are involved on the monitor screen at all, just room numbers, and we are able to look at the screen and pick out, if there's any problems or anything. We could see if there's any problems or anything, and we could run into the other room if we need to. I've worked at larger hospitals, even smaller hospitals, and they're all basically getting into this if they haven't already and been in it for years. It's definitely an asset to the hospital, to the community. I feel a lot safer working here with the monitoring system than I did without. I was very uneasy when I came here, coming from a larger hospital at the time where we had central monitoring. And they hadn't had it too awful long prior to me being there. So it's a great benefit to all.
We have 4 systems. We have 4 towers, 6 cameras, 9 scopes that we use, and we can use them in whatever room we need to. It's like going from your old tube TV to your flat screen TV at home. It benefits me because it makes it easier for me to show the doctor what he needs to see to do the surgery. We're able to distinguish between the different tissues better with this monitor and this camera system than we could with our old one. When you can see what you're doing better, it makes for a much safer procedure. When people donate to the foundation, it's nice because the whole hospital benefits in one way or another. When you give money, we're able to get the new equipment so we can stay up to date with other facilities, so we can stay cutting edge and compete with other hospitals around the area.
Those are 3 of the latest examples of your donations at work, providing real improvements for the hospital and our community. Every donation makes a difference, no matter the size. The intent is just as important as the amount. If each employee gave $1 a paycheck, we would triple our annual donation to the hospital and continue to offer upgrades. Maybe the next update will involve your department and provide your area with a modern update or a needed piece of equipment. My other important job as campaign chair is to thank you for your continued donation. For those of you that give each year after year, thank you. For those of you that are going to give this year for the first time, thank you. And for those of you who have not yet given, please give. Thank you for your time and making a difference at Chenango Memorial Hospital.